In the case of Corozal, that this is being presented in a law enforcement officer. She's 28 years old, resides in Ranchito. But of course, when we look at the dates and the symptoms being presented, it's quite classic of what we would expect: the shortness of breath, the fever, joint pain, the loss of appetite. She basically started with that on the 22nd of July. She started feeling ill, consulted over the weekend, the 25th, at the hospital. She was seen primarily there, asked to get swabbed. From there, on Monday, the 25th, she was admitted and isolated immediately into the isolation area with the suspicion of COVID. Of course, that diagnosis came afterwards, that we did find out that indeed she tested positive for that.
That person has been in the hospital for more than a week now, progressing rather slowly, but she is still having minor respiratory and gastrointestinal symptoms. She's being treated for those and for added infections. So the report we got this morning is that she is now 24 hours without fever and without supplementary oxygen. She still may require it as you move along and you make efforts. When you read the literature, it speaks to people having respiratory distress up to months after they have recovered, because there seems to be pulmonary damage that can be for a prolonged phase.
We do know that the contact tracing has started with her immediate contacts, her co-workers as well, with the night shift. She has been working on night shift. But what we're trying to establish here is that we have not been able to establish any kind of travel outside or contact with anybody that has crossed the borders or anybody that has been dealing with any contraband goods. So for us, this here does merit an intense investigation. We have the individuals working with her have been isolated. That investigation is ongoing with them as well. Her family members, which are 6 in the household, have already been isolated and have been swabbed as well. We do know that of interest is that she did visit San Pedro from July 15 to the 17th. She was in San Pedro for a court hearing, so she attended that in San Pedro. Her symptoms started on the 22nd. On the 25th, we do know that she attended a church service in Ranchito. And from there, of course, the first contact she had with the health facility. Pretty much after that, she has been hospitalized and is responding favorably and is stable at the moment.